Hello, my name is Furkan Can and this is my YouTube channel. In this first episode in English, we will talk about consequences of war. But we are talking about indirect consequences, not direct consequences of war. So, what's the point of talking this subject is real human cost of war. Real human cost of war cannot be calculated through with like how many have been killed or how many people have been injured or cost of water supplies. These are not total cost of war. If you want to think about this in more realistic context, we should look at more in indirect consequences of war. These chronic diseases will appear much more time after war, and they are not solvable like direct consequences. For example, if doctors decide to amputate a leg or legs, they amputate them, and in economic sense these are much more practical and understandable. But if someone has a depression or if someone has a mental health problem after 20 years war, these problems doesn't have practical solutions as we talk about amputation or hypertension or another direct problem. What is the point, we ask ourselves? And I really care about this problem because Yuval Noah Harari once said, democracy and peace are like beautiful flower in desert. We all must do our part of the job to save this flower if you want to see it again. After we become doctors, we should look at this problem like a health problem, not like general at army. And if we are able to better understand this mechanism, such as depleted sources and damaged infrastructures that causes increases in disease, disabilities, and death, many lives could be improved and saved. Another question is what changes during the war that causes these problems. What are the problems? And this is common knowledge: depletion of resources, lack of access to healthcare, which countries struggle to maintain their position in healthcare, and general disruption people's everyday lives. Armed forces creates excess stress and burdens, which increases morbidity and mortality. Armed conflicts increases cardiovascular diseases mortality rates across countries and over time, as well as incidence of infectious diseases outbreak. So we should more look at these indirect problems, indirect consequences of war. Social scientists have begun to realize the importance and ultimately the necessity of studying war, but they are doing this with more focused in acute problems or direct problems. And less developed nations spend more money in like guns more than education or healthcare. And United States, China, Russia, France, and United Kingdom combined produce 90% of the arms sold in the world. If we want to speak about these consequences, we should look at these as categories. And one of the categories which I am going to talk about is medical infrastructure. Medical infrastructure represented by mostly with three variables. These are number of hospital beds per 1,000 people, 2 per capita health expenditure. Third variable is number of physicians in a particular country. These are three variables of medical infrastructure, which is important for us in during war, normal life, really. In 1990, armed conflict was the 16th cause of global burden of disease. It is expected to surpass HIV, AIDS, and become the 8th leading cause of by 2020. Women and children tend to suffer disproportionately as a result of armed conflict. Child mortality rates have been shown to increase more than twofold during even short periods of conflict, such as Gulf War in Iraq. And as humanity grows, our technical capabilities improves also. And with this technological advancement of weaponry since Second World War, civilian wartime casualties have been increased to 10 to 19%. And during war, differences between genders becomes more palpable, such as women bear more of the indirect brunt than men. However, men tend to experience greater mortality and morbidity as a direct result of conflict, which generally increases the burden of women who are left to care their children, other members of household, and themselves. And these women also are left with added economic, political, and social responsibility. And many of the experts add that gender inequality experienced by women is magnified by the conflict, armed conflict. Women suffer more in terms of human rights, access to resources, and personal safety. It stands to reason that women experience higher rates than long-term negative effects because they live longer to see them, experience them. This is another way to look at this gender inequality. And if we start to talk about health outcomes of war, studies have shown that risk factors such as obesity, cardiovascular diseases were disproportionately higher among men and women after and during periods of armed conflicts. And if we tackle this question about acute problems, we could see that cholera and malaria appear most often in studies exploring this connection between armed conflicts and infectious diseases in these areas, war areas. During conflict or after conflict, there is lack of supplies, and these resources, depletion of resources, creates serious problems, such as this is especially true when large numbers of people displaced and relocated into refugee camps where there is often limited resources, limited access to healthcare, clean water, and sanitation services with very high population density. These conditions creates the perfect environment for the rapid spread of the infectious diseases. If we want to look at cholera, for example, these cholera problems, it is very easy, relatively easy in context of history. We can solve these issues very quickly, but without clean water in the area of armed conflict, we cannot tackle this problem. And one of the key elements of subject in this context is infectious diseases becomes apparently much more quickly than, let's say, chronic diseases. An outbreak of infectious diseases can cause thousands of people dying because infectious diseases outbreaks can be accounted for by exposure to contaminated food, water, contact with poor hygiene conditions, and dense populations living in close proximity with each other. And this is exactly what we are talking about, like refugee camps. Mortality and morbidity among working age populations creates most deleterious effect on society, as this population supports both young and older generations. And cruel tactics of war, such as sexual violence, calculated sexual violence, can magnify gender equality in experienced by women in armed conflicts. This cruel tactics is also responsible for increase of sexually transmitted diseases, unwanted pregnancies, and damage to women's reproductive health. These problems, gender inequality in war, not like cholera, is very dangerous in chronic times. It's much more after the war. Typically, cholera is treatable if lost fluids and salts are replaced. If severe cases are left untreated, death by severe incubation period is very short, and 2 hours to 5 days. This short incubation period can increase the chance of widespread infections. So we can solve these issues in modern cities, or not during the armed conflict, but this very essence of war or armed conflicts, we are in a context which we weren't before. Cholera is dangerous. Cholera is more dangerous than other diarrheal diseases because it can kill healthy adults in a matter of hours if we don't supply their sanitation and clean water supplies and lost liquids and salts. If we don't provide these people will eventually die. And some of the experts found that increase in ischemic heart diseases mortality associated with combat veterans who experienced traumatic leg amputation, and they found that the increased risk of cardiovascular disease to be associated with war experience and also related to post-traumatic stress disorder. And some of the other experts used birth weight data and late life hospital admissions for cardiovascular diseases to examine the effect of undernutrition in infancy on later life cardiovascular diseases. The data coming from German occupation of the Channel Islands during Second World War is a control group of individuals born at the same time and who had been evacuated or otherwise left the area were also used in study. And these experts found that cardiovascular diseases was correlated with exposure to occupation, and lack of proper nutrition was cited for major factor. And interestingly, the level of democracy appears to have statistically significant impact on male but not female mortality. Efficiencies are not very large of any models, but the experts suspects that countries that are more democratic may have better information systems which allow for better record keeping. In other words, democratic countries may more accurately report armed conflict while non-democratic nations may underreport it. And as a result, how can we solve this? I read about this in academic papers, and solutions, part of the solutions I read is this: collaboration between public health experts, political scientists, sociologists, will be necessary in order to achieve comprehensive understanding of causes and consequences of armed conflicts in relation to health of populations. And many of these indirect outcomes effects only become evident over time. Policymakers and those who have the most control of initiating the violent acts often do not take these factors into considerations. And if we want to solve these issues, these are the solutions, or these are the starting points of discussions. These readings of mine about consequences of war can bring you some perspective about war and armed conflict, and then can give you some starting point for your own research of your own readings, and we will live in peace and we will live in harmony that we generally don't think about because we have those in this time, in this location. So have a nice day, and don't forget to like, subscribe my other channel and this channel. See you later.